Good evening, William. Thank you so much for joining us today on the SDG Impact Stories. Could you please briefly introduce yourself?
My name is Dr. William Mapham, and I'm a South African doctor who runs a company called Vula Mobile.
Amazing. So how would you describe Vula Mobile in just a few words? What's the mission or the purpose?
So our mission is to make sure that everyone has access to specialist healthcare. And we do that. Our vision is to have a network of all healthcare workers in Africa so they can connect with each other and provide better healthcare.
Great. And so when we look at the challenges in South Africa, what are the current challenges when it comes to healthcare workers? And what are maybe the common issues that you find globally?
So I started my life as a rural doctor. There were about 3 of us running a hospital that served a population of 250,000 people. So we were very busy. If you can imagine 3 doctors for Geneva or something like that. And the biggest challenge we had there was that we had no access to specialist advice. We were the only ones who could treat, and we had no access to anyone who could actually help us. And it was later when I specialized that I realized the problem wasn't just in the rural areas. Working as a specialist in the public sector, we were overwhelmed with patients who didn't necessarily have to come through, or had come through too late and had suffered diseases that they could have been cured earlier. And then also at a health management level, we didn't know where referrals were coming from. We didn't know the referral patterns or why people were being referred. So we had to create Vula to solve the problem at those 3 levels. So for the rural healthcare worker, they've now got access to over 50 specialties. So suddenly, rather than be able to just manage their own patients, they're able to get advice from specialists and treat more patients appropriately. And then from a specialist point of view, we can streamline the referrals we do get so that only the right people get through to specialist care. And then from the health management point of view, because they can see all this communication data, they're now able to make better decisions and allocate human resources better.
Right. So less administrative work for you. And maybe for the patients, it's also frustrating to be referred to the wrong doctor and then...
Exactly.
Yeah.
So patients often have to travel up to 7 hours to get help from specialists in South Africa. So I'm not sure if you would travel 7 hours to see a doctor, but people really need to see specialists.
About it.
Yeah.
So less than 2 hours.
Exactly. So for them, it's made a huge difference because now essentially they're getting specialist guided healthcare at a primary level.
Right. And so that's in South Africa, right? How do you see this problem as can you see it in other parts of the world?
So we've recently expanded to Namibia and Botswana. They're similar to what we have a province here in the Northern Cape, where there are only 3 million people, but they're spread over a huge distance. So in Namibia, you can drive up to 5 hours just to get to your clinic, which is incredible. So people don't have many options. And again, in those 2 countries, there are only a few specialists. So Vula helps them maximize that resource and make the system better for everyone.
Right. That makes sense. So now if we get into Vula Mobile and what the solution you have actually, could you tell us more about how it works? What are the services that you provide?
So we had to make Vula applicable and usable in our environment. So data is one of the restrictions in our area. And so we had to make it so it's 20 times, uses 20 times less data than WhatsApp.
And why is data a problem?
Often the connectivity is poor. So you're not going to have a 5G connection at the bottom of a valley. So it has to be something that can work offline and then connect appropriately when you do have connection. And data also can be expensive for us. We don't have Wi-Fi everywhere. So people pay for their own data to use Vula. And so it has to be very cost effective to use.
Yeah, that's right.
Yeah.
And so, what are the services that you provide?
So for a primary healthcare worker, like a nurse or a GP or a doctor in a hospital, they can go onto the app. It's a simple messaging app. You don't need any training. No one trained you to use WhatsApp, so hopefully no one's ever trained you to use Vula. And what it does is that they enter patient information. It connects them to the correct specialist on call in their area. The specialist can then respond asynchronously because we're using chat most of the time. And then, for example, I as a primary healthcare worker can see my next patient, and when I get the response, I can get the right advice for the first patient. And the specialist then can actually manage the referrals so that they don't have to answer the phone, be interrupted. They get the information they need in a structured way and can make the appropriate responses. So it's quite simple to use, but the real, yes, and we spent a lot of money on user experience. It's our primary goal because no one's ever been paid to use it. No one pays to use it. So if it doesn't solve your problem, you wouldn't use it. So it's kind of a hardcore kind of way of approaching things, but it's worked so far.
And so why would you say that this business model is considered a game changer? Why is it maybe it is cutting edge technology, I would say, but how do you see this as something really exceptional in the healthcare industry?
So healthcare is a very stressful environment especially for healthcare workers, and they need things that actually de-stress them in a sense. So in order to be cutting edge in the healthcare sector, you have to be very, very user-friendly. And the system has to make sense, and the system has to save money, because it's also a scarce resource. And that's what Vula does. It's really simple to use. It solves a problem for the healthcare workers that use it. And at the end of the day, it saves money for the health systems that use it as well.
So Vula Mobile has the app. Is there anything else that you do in terms of maybe education, blogs, or using Instagram for the health workers?
So until this, sure. So until this year, we didn't actually really have much of a social media presence. We didn't have the resources to allocate someone to it, and I wasn't sure if it would be useful. So we only started our social media this year, and it's made such a massive difference already. We now get approached by people who want to use Vula. People phone us and say, please, can they use Vula in their area? People hear about Vula from areas that we never would have thought of. Like I got a phone call from Canada and Jamaica today. Another phone call from the head of psychiatry in Gauteng, which is one of our biggest provinces. So I think perhaps I didn't fully appreciate the power of social media until we started. But it's definitely something that we are including more now.
And in terms of education, is there anything that you can do with Vula Mobile?
So what's been interesting is that when people studied Vula, they realized that people learnt case by case. So there was a nurse who worked about 5 hours north of me, and every time she made a referral to me, I would teach her something. And then after a while, she stopped contacting me, and I was worried about her. But when I called her, she said, no, she's fine, but she knows what to do now. So she had learned case by case in a practical manner on the patients that she's seeing every day. Didn't have to go away for a course or anything. The universities have now picked that up and realized that Vula could be a teaching tool. And so now the students refer cases or send patients to their teachers who then teach them case by case of what they should do with their patients. So listening to our users, we learn a lot from them as well.
That's a really interesting point. So you're working with the university. Are there any other partners that you have with Vula Mobile, the government, organizations, NGOs?
So we've typically got three types of partners. One is the government themselves, especially in the public sector. Another one is commercial companies, like large pharmaceutical companies like Sanofi, Novartis, AstraZeneca. And what we do with them is that they want to improve health systems, and they also come up with new medications sometimes that need to be promoted. But we're very selective. But for example, Sanofi had a medication that decreased the treatment time of tuberculosis, which is one of our biggest killers, from 9 months to 6 months. And now how do you tell everyone? And so Vula was the means by which they advertised that particular medication. And the last kind of partners are research institutions and NGOs. Often they want to have an impact in a certain area, like psychiatry. And we're now part of a consortium looking at that.
Really interesting. So now if we look at the impact that you have, how can you measure it? Well, I guess you have a lot of data, but also what impact has Vula Mobile had up until today?
So I'm glad you asked that because I checked just now. But as of today, Vula's helped over 760,000 patients. We've just gone over 26,000 healthcare workers registered on Vula. And currently, I think in our first month, we saw 20 patients in the first month, and we were so excited. But now it's running at about 1 patient per minute. So it's
Wow.
nice to know that even while we've been talking,
Had 20 patients
yeah.
in between.
yeah, it's a nice figure to be able to say.
Right, amazing. And then you're planning to scale in these 2 other countries.
Yes, so the next countries will be, we focused on Africa, but we will accept requests from the developing world. We believe that's where we can have the most impact.
Definitely. So now to close our excellent talk, could you describe Vula Mobile in just 3 words?
3 words. I think healthcare has to be one. I'd say fast, effective healthcare, or fast, efficient healthcare.
Very good. That was a good one. Thank you so much. For the audience, do you have any last comments, advice, or thoughts that you want to share?
I think health is a very pertinent topic at the moment. Everyone's become aware of healthcare during COVID. Everyone's become aware of how technology can change things. And so if you're a company that's involved in healthcare and you want to improve systems, we'd love to hear from you for a start. And of course, always here to offer support or advice to people who are just starting out. A lot of people helped me in the early days, and so hopefully I can pass on some experience.
The collaborative environment.
Yeah.
Amazing. Thank you so much, William.
Thanks so much.